The Doze app, a unique approach to overcoming sleep problems in young adults. Poor sleep affects approximately 2/3 of young adults. Common problems include difficulty either falling or staying asleep, falling asleep at unhelpful times such as during the day, and feeling the need to sleep for extended periods such as at weekends. Teenagers undergo a natural shift towards later sleep times and are particularly susceptible to sleep difficulties despite the need to maintain early rise times for school. The impact of insomnia as it is defined clinically includes risk for poor mental functioning, depression, substance abuse, and even suicide. Dr. Colleen Carney, a professor at Ryerson University, Canada, and the director of the Sleep and Depression Laboratory at the same institution, has developed with her team an evidence-based sleep app called Doze to help improve sleep in young adults. Doze has the potential to overcome the current gap in the provision of sleep interventions for this critical age group. Cognitive behavioral therapy, or CBT, assumes that changing thoughts, attitudes, and behavior can have an impact on physiology and the way people feel. Through identifying thinking and behaviors that can be unhelpful and teaching individuals the skills required to cope with health-related problems, CBT can be used to successfully treat a wide range of conditions, including anxiety, depression, and insomnia. Unfortunately, there are multiple barriers for individuals when it comes to accessing CBT in its traditional face-to-face format, including a lack of trained therapists. In recent years, interest has increased in delivering psychological therapies such as CBT remotely to allow readily available large-scale provision. Dr. Carney and her colleagues embraced this utilization of technology with the development of their bespoke app. Importantly, by using mobile devices such as smartphones to help young adults overcome sleep difficulties, the Doze app uses technologies and approaches that young people are already familiar with and drawn to. Research has confirmed that it is most effective to provide young adults with immediate access to treatment resources, and an app is the most efficient way to provide this support. Doze, which stands for Delivering Online Zs with Empirical Support, utilizes a web self-management system that allows young adults to access information and interactively learn about strategies to promote sleep. The principle behind the app was to utilize evidence-based sleep treatments that young adults would want to use and that healthcare providers would be able to refer their patients to. To ensure ready access and engagement, Doze combines web-based delivery to provide information about sleep and supplemental resources with a smartphone app that provides instant assessment and feedback on monitored sleep behaviors. The main goal of CBT approaches to treat insomnia is to increase the young adult's sleep self-efficacy. Consistent with this, the Doze app aims to help young adults identify patterns in their sleep patterns and devise sleep schedules that are consistent with their current sleep regulatory system. Dr. Carney and colleagues have already put Doze through rigorous feasibility testing. In one trial, 51 young adults aged between 15 and 24 were enrolled. Participants used the app for sleep monitoring, goal setting, and as an information resource regarding sleep over a period of 4 weeks. The most common goal set by participants was to reduce the variability of getting into and out of bed, followed by altering the time in bed based on feedback. The third was to reduce lingering in bed after the alarm. Although the primary aim of this study was not to assess efficacy, Dr. Carney and her team nonetheless found that their app meaningfully improved sleep for all participants, regardless of whether they met clinical cutoffs for insomnia. Further improvements were found for daytime sleepiness, energy levels, and overall quality of life. Dr. Carney firmly believes that by giving young people feedback on sleep and providing them with resources to learn how to improve sleep, then allowing them to make choices as to what they want to change can have a positive impact. Work is now ongoing with Pivot Design to further improve the app, which Dr. Carney hopes to ultimately make freely available for young adults experiencing sleep difficulties.